talking about senior housing opportunities. And this is about our free legal clinic that we have once a month as well.
Battery.
No. Please do may qualify for reviews.
Thanks everybody for coming. We have Jane and Emily from the Medicare Rights Center who are going to give a very fine presentation on Medicare policies and enrollment and things that you need to know to keep abreast of changes in Medicare. We'll have later a presentation from the fire department, from Captain Anderson, and following that, we're going to have a reception sponsored by Brewer. We have Sheila Warren over here from Yale's office, and Gail herself will be making an appearance. As resources, we have people from the Department of Finance that are available in the back to answer any questions you might have around SCREE, Senior Citizens Rent Increase Exemption Program, or DREAM. There's a lot of resources in the room that are of importance to you, and I urge you to take notes, listen up, and I'll just pass it on right now to Jane.
Thank you.
Can you hear me?
No.
I'm going to try without the mic. How's that? No. Okay. Yeah. He's right. There's a trick. I think they pulled the very close to his Today we're going to talk about Medicare. Emily, my colleague who's operating the projector, and I are from the Medicare Rights Center. And we're a not-for-profit consumer organization that helps older people with Medicare questions.
Can you make it louder? There's so much din back here, we can't hear you. They gotta stop talking back here.
Somebody's going to try and see if they can make it louder. Is that better? I think you have to
Like that. Maybe you gotta hold that up so the receiver catches the signal.
Okay.
That's not it.
Can everyone see the slides? That's good. Can everyone see the slides? Okay, I just want to also tell you before we even start, Emily and I are going to be here after everyone gives their talks. We'll be in the back. If you have other questions, you can come by and see us. We also have a sign-up sheet, so if you would like a call back for something a little bit more extensive or a little bit something you'd rather talk about a little more privately, we can call you back. The Medicare Rights Center runs a helpline. If you have questions about Medicare, you can call our helpline. The number is 800-333-4114, and we can answer your particular questions. We also can help you enroll into some of the programs that help you save on your Medicare premiums. Today, we're specifically going to talk about fall open enrollment. This is the time of year when you can change some things about how you get your Medicare. Does everybody in this room receive Medicare?
Yes.
Yes? How many of you are on Medicare Advantage policies? Do you know what that means? That's when you receive Medicare through another company like Emblem or United Health. Okay? This is the time of year where if you're not happy with that company, you can change to either another company or you can go back to original Medicare. You have until December 7th to make that choice. The other part of Medicare that you can change this time of the year is your Part D, or your drug coverage. If you're not happy with your current plan, or if you got a notice from your current plan that they're discontinuing, this applies to the Medicare Advantage as well. Or they're changing their doctors, or they're changing some of their rules. You really want to check all the announcements you've gotten and make sure that going forward as of January 1st, there won't be changes to your Medicare Advantage plan or to your prescription plan that's going to unhappily surprise you. So once again, if you need to make changes or you're not sure if you need to make changes, you can call us and we can help you figure out if you're doing the right thing. The number again is 800-333-4114. We're also going to talk today about some savings programs for ways for you to get assistance if you need help paying your Medicare Part B premium. Okay, so the fall open enrollment season is from October 15th through December 7th. So we're almost at the end of it now. And once again, you should review any notices you might have gotten from either your prescription coverage or from your Medicare Advantage coverage. Make sure your doctors are going to be on the insurance company next year. If you're not sure, you can call the insurance company, you can call the billing department of your physicians. Make sure they're going to be taking your plan next year. Also with your medications, you want to check to make sure that the medications you take are going to be on the formulary for the plan for next year, or there won't be restrictions on the medications. We can help you if you at Medicare Rights, we do run a plan finder. If you need extra assistance with your medication plan D, we can help you find the best plan, one that will cover all your medications. So there are the two options always. You can stay with the Medicare Advantage plan or original Medicare. You can switch from original Medicare to a Medicare Advantage plan. And for those of you who don't know, a Medicare Advantage plan provides all of the same things as Medicare. It usually provides a few extra things. It might have vision coverage, it might have dental coverage, but it also has some restrictions. It's going to restrict which doctors you can see or even which hospital you might be admitted to. So you want to check those restrictions very carefully. If you're not happy, you can go back to original Medicare. If you prefer a Medicare Advantage plan, you can switch to one of those. All of these switches have to be done by December 7th, and they take effect January 1st. Okay. Most people in the room, I think, have original Medicare. Is that right? Is anybody not sure about what they have? Because sometimes people are a little bit confused. Okay, the difference in original Medicare, you have the red, white, and blue card from the government. It says Plan A and Plan B. You can go to any doctor anywhere in the United States that takes Medicare. You're not restricted. The major difference with a Medicare Advantage plan that might be Emblem, United Health, AARP, Blue Cross, there's a number of companies that offer them. With those, you are restricted to the doctors that participate in that plan. You might need a referral to go to see another physician or another specialist. With original Medicare, you usually pay 20% co-insurance for any services you receive, and you would have to have a separate drug prescription plan. When you have Medicare Advantage, there may not be any co-pays, or there might be. Each plan's a little different, and your medications are usually covered under that same plan. Okay. Any questions so far? Yeah?
One thing I'm not noticing is what are the deductibles? Right now, Plan B this year is $147. I guess Plan A is about $1,188. Is that going to change January 1st, or are we going to find out sooner?
We haven't been notified
So,
yet. Emily?
the Part B, the Part B deductible will be the same next year,
Okay.
and the Part B premium is also going to be the same next year. I think the Part A deductible is the same, but I'm not 100% sure on that. But we do know that the Part B deductible will still be $147.
The Part A deductible means when you're in the hospital, for every 60-day period that you're in the hospital, you have to pay a little bit over $1,000 during that time. If you're re-hospitalized, let's say you go home after 5 days and then you're re-hospitalized 10 days later, you wouldn't have to pay the deductible again. But if you're re-hospitalized in another 60-day period, you would have to pay it. So these rules can be different with Medicare Advantage plans. So you do have to check all of those things.
Is that $1,000 per day or?
No, that's on the total hospital bill.
Too much.
Yeah.
She said specifically what it was, 1,000 what?
One, is it 1,100? I think it's $1,180 something dollars. Yes?
A person has the advantage plan, they still have to pay the
Every plan is different. You have to speak with your plan. You mean the monthly premium?
147.
Right. That's your premium. That's your
Well,
premium.
Is it? You have to pay when you have Medicare or
It depends upon the plan. Every plan is a little bit different. You have to look at the plan. You still have to pay the 140, but what you have to pay for a doctor visit, etc., is different on each plan.
you still have to pay 147 or
140.
in any case, whether it's on 100%.
Yes, unless you qualify for one of the Medicare savings programs.
So just to clarify, the 147 is a deductible, which is not the Part B premium. So the 147 is the Part B deductible, which means if you're in original Medicare, before Medicare Part B starts paying 80% of each service, you pay $147 out of pocket. That deductible can be totally different in a Medicare Advantage plan. Now, separate from that is the Part B premium, which is around $105. Everyone pays that, regardless of how you get your Medicare. The only way that you cannot pay the premium, which is $105, is if you have the Medicare Savings Program, as James said. So there's the deductible for Part B, and then there's the premium, and they're two separate costs.
So the deductible is when you go to the doctor.
Premium and which is called deductible.
So when you go to the doctor, let's say it's January 2nd, and you went to the doctor for the first time this year, and you had some stuff done, and the total bill was $800. You would have to pay the first $147, because that's your deductible. And Medicare would pick up 80% of the rest. You only have to pay the deductible once a year. That's an original Medicare. A Medicare Advantage plan may have different rules, and every one is different. We can't generalize about them.
What she said about 105.
That's the monthly amount you pay.
That will
Might be taken out of your Social Security.
everyone.
Yes, unless you qualify for one of the Medicare savings programs, which Emily is going to talk about.
That must be for the lower income.
Yes. Anybody else? Okay. So we're clear on what's original Medicare and what's a Medicare Advantage. And as we said, in an original Medicare, you're going to pay $147 deductible for the first medical services that you have during the year. You can get your service at any doctor in any place across the country that takes Medicare. You'll have a 20% co-insurance. So when you go to the doctor, Medicare pays 80% of the fee. You will have to pay 20% of the fee. And you must get your standalone drug plan, which usually runs between $30, $60, depends on which plan you choose. If you have original Medicare, the only thing you really have to do is make sure that your Part D plan for next year has the medications on its formulary. The formulary is the list of drugs that the plan covers. It can change from year to year. So you do want to, you can call the company, you can call us, you want to make sure that you're going to have all of your medications covered. Part A and Part B is original Medicare. Part A covers hospitalization, Part B is doctor's visits, lab tests, and then Part D is the drug coverage, and that's a separate plan that you pay for. Yes?
Just a small addition to what you said. My plan is called Medicare Complete.
That's probably a
It's the same
Medicare.
Advantage.
Okay, it is the same. They have a lot of different names. You know, it might be AARP Senior Care. I think Emblem is a big company in this thing. United. If it's got anything different than the red, white, and blue card that you got from the government when you turn 65, then you're probably in an Advantage plan. And you probably have a list of doctors that you can see. You have to see people on that list or they won't pay for the service. They may even have a hospital that you must use if you need to be hospitalized. So you want to check all of that out before you're committed to it for another year. Okay, anybody else? Okay. So in the Part D part, the drug plan, it covers your prescription drugs. Each of the drug plans, and there's lots of them, have their own list of drugs. That's called their formulary. Some of the drugs plans make it cheaper if you do it by mail order. You might get 3 months supply at once. Some of the plans are very inexpensive to use generic drugs. You have to ask your physician if that change is okay for you. There may be medications that require some restrictions. The doctors may be required to try a different, less expensive drug before you get to that drug. Or they may have limits on how many pills you can have at one time with the same prescription. There is a monthly premium, and these plans also have co-pays, deductibles. There's all kinds of restrictions on them. Each one is different, so it's important you understand what your plan covers. The other thing I want to talk about just is the Medicare marketing rules. This is the time of year when you're all getting lots of information in the mail. Every other day there's a big glossy flyer from someone. You don't have to make a change. If someone, and Medicare actually regulates how the Medicare Advantage plans are allowed to be marketed. They can't call or email you unless you've requested it. It's probably not a good idea to invite someone to come to your apartment and talk to you about it, because they're probably going to put a lot of pressure on you to buy a plan. If you have questions about these plans, you can call us. You can also call 1-800-MEDICARE. That's the Medicare office, and they will answer questions. So don't make a switch so lightly. Make sure you've investigated all of the options before you decide to sign up with somebody. And sometimes these plans, their advertising can be very misleading, and they can imply that they're calling you on behalf of Medicare. Original Medicare does not advertise. You get one book at the beginning of each year called Medicare and You that tells you everything about the plan, and they don't send you flyers in the meantime. So anything that you're getting in the mail right now is an advertisement. It's not a notice from Medicare. Yeah?
If you have basic Medicare and get drug coverage, is there an extra premium for that?
You have to pay a premium for the drug coverage. That doesn't come from Medicare. That does come from a private company. And the premium for that can range from I've seen them as low as $12 to $100. It depends on what drugs you need, where you're going to buy your drugs, whether you're going to use mail orders. So there's a lot of different parts to that. If you need help finding a drug plan, please sign your name up in the back. We will have someone call you, go through your medications, and help you pick out the best plan for you. Yes?
I'm concerned that the government shutdown this year, which shut down Social Security, has put everything later. Are we still going to have to stay to a December 7th?
Yes, I don't think there was much of a shutdown, so to speak, just for a couple of days in the Medicare office. All the deadlines are exactly what they were. We haven't gotten any extra time period. So December 7th is the cutoff.
Because I got a receipt of November 2nd and I submitted it October 10th. And when I got the receipt back from Medicare, they put down November 2nd. That was.
Well, there was a couple of days when all the government offices were closed, so maybe it was during that. Yeah, but there hasn't been any extension on your deadlines. Yes? Did you have, you spoke. Yes?
I just want to go back a second.
Sure.
The comment you made. I've been disabled since 1997, so I was on Medicare, with disability. But I'm on Medicare and Medicaid, I'm dual eligible. But I want to make a comment to what you said about medication. Many medicines that I've taken where the Medicare D program wouldn't pay for it, they wanted me to take a generic. I've gotten very sick and wound up in the hospital.
Right.
Whether you know it or not, many of those generic medicines have fillers in it that people are allergic to. And I just want to remind everyone, you're not forced to take generic medicine. If you have any reaction to any medication, your doctor has to file for an exception to policy with your Medicare D plan or get a prior approval that you cannot take those generic medicines. And a lot of people don't know that.
Thank you for bringing that up. That's a very good point. If you have any concerns about any medications, or if there's a sudden switch in the pharmacy to a generic when you didn't think you were getting a generic, you should absolutely check with your doctor. Your doctor can telephone Medicare, the Medicare drug plan, and ask for an exception to the rules. Yes?
Well, I've heard that's also true with mail order pharmaceuticals, that you need to be very careful that you're getting the quality and the medication that you expect that you're ordering when you order through mail order, because they could bait and switch that way, I've heard.
Well, I don't,
There's no control over that, in other words. As far as I know.
this is not,
Oh, no, Jane.
I don't know what happened to it, but, as with any medication, you should always check the label on the bottle to make sure it's what you're expecting to be.
But you still never know where it came from.
Well, I guess we don't never know about any of it, but,
Well-
if it's a generic and your doctor did not mention to you that he was giving you a generic, you should telephone the office and make sure that it's okay for you to take it.
And mail, and
David's giving you a live one.
And Medicare Part D plans do usually contract with specific mail order companies. So if you choose to get your medicines through mail order, which many people do because it's often cheaper that way, if you're having issues with that mail order company, if they're not sending you what you ordered, you can always talk to your plan about that, because the plan contracts with the mail order company. You know, so that could be a first step that you take, and you can also talk to your doctor to make sure he's prescribing the right thing.
Yes?
I have a small tip. When you get a prescription, make sure that the doctor puts DAW, dispense as written. That means it ensures that you get it, and Xerox it before you submit it. That way you have a copy.
Oh, that's a good idea.